Hi, I'm Erin Shanefelder-Gonzalez. I'm a psychologist in the Pro Clinic that's part of Seattle Children's Hospital Outpatient Psychiatry. And I'm going to talk today about what is ADHD. So ADHD is a neurodevelopmental disorder. The neuro part refers to the fact that it's based in the brain. And I'll talk in a couple minutes about the types of brain differences we see for people with ADHD. The developmental part means that it's with you starting when you're very young, and it tends to stay with you in some capacity over time, even though the way the symptoms show up may change, or they may get less noticeable or more noticeable over time. So if you go and bring your child for an evaluation for ADHD, there are 5 things that we're going to be looking for. The first thing that we're going to be looking for are the symptoms of ADHD. And there are 2 different clusters of symptoms for ADHD. The first cluster are the inattentive symptoms. So these are things like getting distracted easily, having trouble following through on instructions, or being disorganized and losing track of things. The second cluster of symptoms are the hyperactive impulsive symptoms. These are things like having a really high energy level, almost being driven by a motor, or not thinking through before you do things. So blurting out, interrupting, or maybe doing things that are risky without thinking about the consequences. In order to have a diagnosis of ADHD, we're going to look at whether your child has symptoms in one category or both categories. You only need to have symptoms in one category to be diagnosed. But you may be saying, as I was talking about those symptoms, those sound like things that every child has, and really most adults have. And you're right, we all have some of these symptoms to some degree. So when we're evaluating your child, what we're looking for is whether your child has these symptoms to a higher degree than most other children their age, and has a large variety of the symptoms as well. So if your child just has the inattentive symptoms, we would call that ADHD predominantly inattentive subtype. If they have just the hyperactive impulsive symptoms, that's kind of unusual to have only those symptoms, although it does happen in very young children. We call that ADHD predominantly hyperactive impulsive subtype. Most common in children is to have both clusters of symptoms, and we would call that ADHD combined type. So the first criteria is we want to know, are the symptoms there to a level that exceeds the typical development? The second thing we're going to look for is whether the symptoms are consistent in different settings. So if your child only seems to have trouble when they're in the classroom, doesn't have trouble with attention in any other setting, we'd want to look to maybe other causes of what's getting in the way at school. We want to see that symptoms are present in multiple settings, and that would include at home with you, going through their daily routines. In the classroom, that's very common that we would see classroom behaviors that are different, and also maybe learning differences. We would also look at social situations, whether your child might struggle to pay attention and follow along with the group in different social settings. We would also maybe look at extracurricular activities, different groups or classes that your child takes, or what they look like when they're doing a group activity. And then we'd also look at any other settings where your child spends time. It could be an after-school care program, could be with extended family members or babysitters. The third criteria we're going to look at is whether the symptoms are causing a significant difficulty, so impairment. So if your child has these symptoms, but they're not having any difficulty getting through their daily life, it's not causing a problem, we wouldn't call that ADHD. The fourth thing is that we want to see that the symptoms were present consistently over time, and that's where the developmental part of ADHD comes in. ADHD is something that's with you essentially since birth. Sometimes it doesn't show up until kids are a little bit older for a few different reasons. One being that all young kids are pretty hyper and distractible, and it's harder to diagnose at a young age. But even if your child is a little bit older, even a teenager or even an adult coming in for diagnosis, we would want to put together some of the history to see if there were signs of these symptoms when they were younger, even if they weren't too problematic yet. The fifth criteria we want to look at is whether or not there's another explanation for the symptoms other than ADHD. So we'd want to look at whether your child has gone through any major transitions lately, changes, stresses that might affect their behavior or their ability to focus. We'd want to look at other types of mental health concerns, like whether anxiety might be part of the picture for them, or their mood, or any other type of concern that would make it harder for them to focus. We might also look at medical conditions that could contribute, things like thyroid, things like sleep. A sleep disorder could make a child look like they have pretty serious attention problems. And we might ask that your doctor do a really thorough evaluation to make sure there's nothing medical that might be contributing. So going back to the neuro part of the neurodevelopmental disorder, we do know that individuals with ADHD have differences in the brain that we can see in terms of imaging studies, so functional fMRI studies. We see that there are differences in how two different chemicals are processed in the brain, and those are norepinephrine and dopamine. These are neurotransmitters that help neurons in the brain send messages between each other. You may have heard of dopamine before. It's considered to be the pleasure chemical, and it's what gives us a sense of interest and reward and motivation. And we know for individuals with ADHD, getting motivated and staying interested are some of the central difficulties. And that's because if you have ADHD, dopamine is not being processed and regulated in the brain in quite the same way that it is for other people. So kids with ADHD may not get as much of a dopamine reaction from daily tasks. And so they're going to find some things more boring than other kids. And that's going to lead them to get distracted and have trouble finishing the task. We also know that it's harder for kids to get really excited about things that are mundane day to day, but they can still get really excited and even hyper-focus on things that are interesting to them, video games being a really classic example. So your child may over-focus on certain things because that's where they're getting a real sense of reward and dopamine. The other area where we see differences in dopamine in the brain is in the frontal lobe. So the frontal lobe of your brain is where executive functions are based. You can think of it as the executive, like the boss of your entire brain. Your frontal lobe helps you with planning ahead, making decisions, getting yourself organized, keeping track of information while you're working on something. And we see that the development of the frontal lobe for children with ADHD has a bit of a delay, about a 30% delay in what we call myelination. And that's a process that helps with the advanced development of those neurons. So we want you to know that if your child is having a lot of symptoms of ADHD, first of all, it's important to get an evaluation just so we can be sure it actually is ADHD that's causing the difficulty, and we can help come up with a good treatment plan. And if it's something else that's contributing, we can help steer you in the right direction as well. But second of all, if your child's having these symptoms, it often looks like they're intentionally just not caring about their schoolwork, being lazy, acting up on purpose, when really there is something different about how they're processing information in the brain and how they respond to information. So we'll talk a little bit more about that in some of the other videos.